Living in an era where sex is glorified and common between friends, frequent club goers, and Tinder buddies. Although sex is not the only transmission material for the HIV virus, it is one of the leading factors. Due to this careless act, infection rates are horrendous, and the number of fatalities are alarming. As a medical professional, my obligation is to inform you of the dangers employed with this disease. As history repeats itself, we are forced to bring awareness to the significance of HIV and AIDS prevention or infection. Through evolutionary medical procedures, we are capable of controlling the spread of the virus and halting the reoccurrence of the 1981 pandemic. In this video, I'll discuss the type of pathogen responsible, how it is transmitted, symptoms, treatment, and historical information. A virus is described as a submicroscopic, parasitic, filterable agent consisting of nucleic acid surrounded by a protein coat. In this infographic video, we'll learn about a specific virus called HIV. The disease triggered by this virus is AIDS. My name is Alphanie Bethel, and I'll be your presenter. In 1947, Francois Barsanini discovered the virus when a patient had swollen lymph nodes. However, this virus is believed to have originated in Africa by consuming SIV-infected bushmeat and later transmitted through the sex trade. SIV is a virus similar to HIV. However, this is only present in animals. Because viruses can sometimes be present in humans but not animals, we can inject the HIV-1 genus lentivirus into the organism. Infection won't be detectable. Hence, they can be used to explore the effects of viral growth and disease treatment. HIV, also known as human immunodeficiency virus, affects the immune system. HIV causes the disease AIDS, acquired immunodeficiency syndrome. HIV can live in your body for an optimal period of 10 years. Bacteria and viruses enter the body, developing an infection site. The body reacts by activation of white blood cells. These cells carry out two forms of defense: releasing chemical signals at the site of infection, notifying defensive cells, releasing signals that help helper T cells to duplicate. Over the span of these years, your helper T cells are fighting a losing battle as the virus replicate each other whilst destroying the cell. HIV is described as a retrovirus, which is spread by dendritic cells, infecting the Th lymphocytes. This retrovirus duplicates by a process called budding. Budding is a form of reproduction bacteria used by attaching to a cell and obtaining their plasma membrane as their coat. The R0 for HIV is 225. This is relatively low due to the fact that this is primarily a sexually transmitted infection. After the budding process, there is little to no white blood cells remaining in the human body. This environment is perfect for AIDS and the breeding ground for opportunistic infections. Common opportunistic infections are meningitis and pneumonia and tuberculosis. Patients are never hospitalized because of AIDS. However, HIV-infected persons are hospitalized due to opportunistic infections such as tuberculosis and pneumonia. Treatment may vary. Tuberculosis has a 6 to 9 period of hospitalization Meanwhile, pneumonia has a 3-week period of oral medication. How can you contact the virus? The virus is transmitted mainly through body fluids, through unprotected anal or vaginal sex, pregnancy, childbirth, and breastfeeding, drug injection needles, and contaminated body fluids. There is relatively no cure for AIDS. The safest way to protect yourself is by abstinence or the use of condoms. How to know if you have HIV? Get tested. There are 2 types of testing method, Western blotting or ELSA. Western blotting method is used to identify antibodies in the patient's serum. Meanwhile, ELSA is used to detect AIDS, testing the presence of antibodies against human immunodeficiency virus. A prevention plan was prepared on the advice of the CDC and local healthcare professionals. Annual testing is recommended. The use of PrEP is recommended. The CDC also recommends that gay or bisexual males get tested every 3 to 6 months. A treatment plan was prepared on the advice of the CDC and local healthcare professionals. Take your medication. They often contain inhibitors. Inhibitors are used to control growth of bacteria by inhibiting their enzymes, preventing the spread from and creating new viruses. HAART, highly active antiretroviral therapy, slows down the virus to enable your body's immune system to fight off infections. Here is some global information on the crisis. According to the CDC, during the 1980s and the 1990s, there was a death toll of 100,777 individuals with acquired immunodeficiency syndrome. In Guatemala, there are about 15,000 individuals living with AIDS and not receiving viral suppressants. The HIV.gov.org states that globally there are about 37.6 million infected persons in the year 2020. Of these, 35.9 million were adults, 1.7 million were children, aged 15 years and older. The purpose for a survey conducted was to understand the relationship between sexually active individuals and unawareness of HIV and how to prevent the disease. When asked the age group, 62.5% were 18 to 25 years old, 25% were 25 to 35 years old, and 12.5% were 35 years and older. 84.4% of these individuals had at least 1 through 5 sex partners. Only 9.5% had 5 through 10. When partaking in sexual intercourse, do you normally use protection? 40.6% answered yes. 34.4% answered no, and 25% answered sometimes. Have you ever attended free testing provided by public health care? Many answered no, because they either didn't know about the testing or felt like they had no need to. In conclusion, I believe that making this information available about free testing and PrEP, we can halt the disease truly.